Hi there, my name is David Coletto and I'm the CEO of Abacus Data. Welcome to In Focus. At the end of 2020, my firm conducted a national survey of 2,000 Canadians, asking them questions about the state of Canada's healthcare system and the role that self-care can play in sustaining it and improving it in the future. On February 3rd, I led a panel discussion with leading experts and policy leaders exploring how self-care is being used around the world and how it can be used in Canada to improve not only patients' health outcomes, but also improve the sustainability of Canada's healthcare system overall. Here's what we heard. So folks, let's start with a basic question, and that is, what is self-care? I think I want to set the level set for everybody watching today. Nardine, when you think of self-care, what do you think that means?
Yeah, so great question. There is no single definition of self-care that's universally accepted in the literature. Definitions vary depending on the setting in which the term is used, as well as the stakeholder's perspective. In fact, a 2011 study identified 139 different definitions. So to some people, self-care equates to more me time or a vacation on a tropical island. These are some of the images that may come to mind for folks. Put them up near the computer. So those are all different versions of self-care, but for our purposes here today, we're going to go with the World Health Organization definition of self-care, which is really the ability of individuals, families, and communities to promote health, to prevent disease, and maintain health, and to cope with illness and disability with or without the support of a healthcare worker. So in other words, self-care is this really broad concept that encompasses everything from making healthy lifestyle choices like being physically active to preventing and self-managing both chronic and minor ailments. There are 7 pillars of self-care that describe really a set of activities that individuals should undertake. So health literacy, self-awareness, physical activity, healthy eating, risk avoidance or mitigation, good hygiene, and the optimal use of products and services. So collectively, David, these 7 pillars really describe the entirety of self-care, and they provide this holistic approach from the perspective of the self-care or the consumer. Fundamentally, these 7 represent a demand side or a demand perspective of governments, health professionals like us, and health services as well.
Thanks, Nardine. Christine, from your perspective, you work in the health literacy space, as Nardine mentioned. It's one of the pillars of self-care. Can you elaborate a little bit about how important health literacy is to this whole concept?
Mm-hmm. Yes, for me, self-care is healthcare. So if people are able to conduct self-care, they're able to take really good care of themselves and their families and communities. And health literacy is a fundamental part of that, as was mentioned by Nardine. So if people are able to find information, understand it, appraise if this is relevant for them, so that they're not manipulated by any disinformation or misinformation, and that they can actually take action and apply information and knowledge, is then we're helping them to manage health and cope with health challenges, and that's self-care for me.
So Judy, from your perspective, from a global perspective, how would you describe the evolution of this concept in terms of the way the governments in other jurisdictions are approaching it, the way the World Health Organization is looking at it? Is it gaining momentum?
Well, one thing Nadine touched on, the WHO definition, which we as a federation ascribe to, certainly, as do our members. But there is a problem that there are so many definitions, as Nadine said, and there are vastly different perceptions of self-care, as Nadine also touched on, from, okay, I'm going to yoga tomorrow morning and having a mud bath, that's self-care. Whereas we look at that slightly differently. It's a good thing to do. So there is a problem that so many people don't know what self-care is, or they have totally the wrong handle on it. So as part of our collaboration with WHO, we are working on the definition. And what we're going to be doing is having setting up a roundtable this year with various experts and WHO to look at the definition, to see if the WHO definition needs to be tweaked or not, and then look at how can we all be singing from the same hymn sheet, so to speak, and really be pushing out there through all our different channels what self-care is exactly.
Right. So there's some work to be done to find alignment on it, but that process is happening, and we're seeing.
Yeah, I think it will be happening this year.
That's great. And Jerry, from your perspective and food, health, and consumer products, you conducted the research that I'll share in a moment. You sponsored this event. Why is this issue important to you and your members in particular?
Well, it has been for a long time, David. But I think if we go back to March of last year, the beginning of the pandemic, and if you think about our concerns were so focused at that time, about will this health system bear up under the pressure? Will we find enough ventilators? When will we get a vaccine? And fast forward to today, and notwithstanding the epic pressures on the system, and questions about rollout of the vaccine, I think we'd have to concede that the system has actually borne up pretty well, thanks to epic efforts on the part of a lot of health professionals, scientists, and public health officials. But if you look at the provision of guidance to Canadians about what they can do to safely navigate this thing, I think we've really struggled. And as a result of that, of course, that's more pressure on the system. So it just serves to underline how critical this is, just not in a pandemic setting, but as an ongoing issue for the healthcare system. And so we think that there's a need for a national dialogue about solutions, again, not just for the present moment, but for the durability and the resilience of our system in the long range.
Well, that concludes the latest episode of In Focus with David Coletto. On behalf of my team at Abacus Data, I want to thank the panel and for all of you for tuning in today. For more episodes on this subject or others like it, please subscribe to our YouTube channel, and I hope to see you next time. Take care.